So yeah, this way. A single smile makes life more beautiful. A smile is a symbol of friendship and peace. World looks brighter with a smile. Smiling is definitely one of the best beauty remedies. A warm smile is a universal language of kindness. We often come across so many quotes that emphasizes on a smile, which makes us question that whether this concept of smile is actually so hyped up or is it real? Well, let me tell you, it sure is real because a perfect smile is far better than a toothache or dental problems. But the question here comes is how do you bring that smile? What kind of a oral hygiene is required for that smile? Hello and welcome to the another episode of PinkTalk. I'm your host Preet Joshi and today we have with us Dr. Shilfa Nigar. This session is going to be fruitful in various ways. One, we're going to have a giveaway prizes, two giveaway prizes. The first giveaway will be for the best question, which will be given the end by Dr. Shilpa according to her choice of best question. The second would be given as a lucky draw by Mr. India. Another reason why this is going to be fruitful is because of Dr. Shilpa, who is actually a chief dental surgeon at Apollo Clinic, is an actor, a spokesperson, and also an entrepreneur. Dr. Shilpa gained her undergraduate degree from prestigious Dr. MGR Medical University and continued to specialize under various famous dental surgeons, both internationally and internationally. She participated in the Indo-US conference in Iowa University, participated in the Indian Dental Association Trinity branch. Was instrumental in conduction of various workshops like Cosmesis 2015, Department of Oral and Maxillofacial. She has won multiple awards, which includes Best Clinical Head for year 2017 and 18, and the Young Cosmetic Award for the year 2020. Along with all the dentistry achievements, she has also excelled in the field of acting. She has won the reality show Village to Villa and also had shooted for multiple brands. Dr. Shilpa, we are really honored to have you here today with us. It's really
Thank you.
glad for us to see you.
Thank you. Thank you.
So,
That was a lovely introduction. Thank you.
yeah. Starting with one of my first question, it's a question really personal to me, I would say, is that as I said in the starting, that so many quotes about smile, a perfect teeth smile. Does a perfect smile with perfect teeth, perfect white straight teeth, determine a good oral hygiene?
Uh, Definitely not. If you ask me, my personal opinion is yeah, sometimes my tooth looks yellow. Generally, for Indians, it's not like we'll never have a perfect white teeth like how you see in a Colgate ad. It's not like that. A tooth which is white is not healthy. A tooth which is yellow is not bad tooth or a decayed tooth. No, it's never like that. The color doesn't define the tooth health actually. It's it, how well your enamel and how well your gum conditions and how well you maintain your teeth. So this will makes a tooth healthy more than the color. So it's never white. It's never white. Especially for Indians, it's not white. It's mild to moderate yellow. That's the color of a natural tooth.
Sometimes the covering of the plaque that actually gets over the teeth, does it actually hampers the good smile, the perfect white smile?
Can you be? I didn't get you the question. Like I didn't get the
The
question.
question is actually that the plaque that we get, the yellow plaque, that actually can diminish the white smile. So always having that doesn't make a good smile, right?
Yes, correct. But the thing is, generally there'll be two kind of stains: extrinsic and intrinsic. Intrinsic is something like your tooth from whenever you are born, due to the water or maybe due to some trauma, like something could have happened when you were very young, and the tooth would have went through the trauma, and your enamel or the dentin and the supporting layers would have got discolored. That is called
Yeah.
intrinsic, that you can never change. that tooth is slightly yellow, it will be yellow, or if not, it will be brown in color. But the plaque and the other calculus, whatever you're talking, is like an extrinsic. It's outside stains due to coffee,
Right.
due to smoking. There'll be a lot of other things which causes then extrinsic stains. So these extrinsic stains definitely make your teeth yellow, and it is definitely not good. Yeah, it will diminish your smile. It will diminish the color of the tooth. But what I was telling you is like the tooth is never white. It's not a complete white. No, it is mild to
Right.
moderate yellow. But the plaque, whatever you're talking, yes, it has to be removed. It is not good. If you have plaque at calculus over a long period of time, what happens is your gums gently will get weak. And then what happens, your enamel will get eroded over a period of time. And the strength of the tooth and the gums will get weak and the tooth might shake. You might lose the tooth because of the calculus and plaque. That is not good. The eccentric stains and whatever has been in your mouth, it has to be removed. 6 months once or yearly once, scaling has to be done for that to remove it.
Ma'am, your voice is a bit low. Can you just speak it a bit
Oh, okay,
louder?
sure, sure. I'll do that. I'll do that. Sorry, I'll correct
Yeah.
that. So the
Okay.
scaling or the cleaning, it's necessary. 6 months once or yearly once, we have to do it.
All
It's
right.
common, even for me. Even the dentist has to do it. It's quite common. We have to do the scaling.
Okay. So it's always the not just the plaque that determines a good health. That's the
No,
answer,
not at
right?
all. Not at all. That's the answer.
Yeah.
The
Yeah.
plaque has to
Okay.
be
So
removed, and you have to have a
yeah.
regular checkup for that. Once you feel the plaque is getting accumulated in your teeth, or while brushing, if you have some bleeding, it's a sign or a symptom which indicates that you need a tooth cleaning, you need a scaling. You can meet your dentist and then get the cleaning done.
Okay. So I was this is a normal thing, that general idea that what are the certain methods or certain things that constitute our oral hygiene? Like, is it brushing or just brushing? Does it include other things too?
Hmm. If you ask me, the thing is, yes, it's only the brushing because you need not even use a toothpaste to be frank, but definitely you need some fluoride. But the way how you brush matters most, more than what we use, like other additional advantage of maybe like mouthwashes you can use, the flossing you can use, it all needed. But the first and the primary one is brushing. If you were able to brush well, and then you remove all your deposits, because generally you eat and the food gets stuck. Once you leave it for quite some time, your brush was not able to reach that particular spot, and then it gets accumulate the microbes and all that get into it, and the food ferments, and then you get a calculus. That's how the plaque and the calculus get accumulate on your teeth, right? So if you were able to brush well and then remove the calculus within 1 or 2 days, within 24 hours or 42 hours, the deposit, like, you will not have the calculus. That's the major thing. So
Right.
once that is cleaned, you will never get a decay. So you need not floss. You will not have a food lodgement. You will not have gum issues. So main first thing is your brushing. If you're able to brush normal twice a day, in the morning and night, all the most of the problems could be sorted out with that. Then next stage. But if you were not able to brush, sometimes, some days we're not able to brush in the night, or something could happen. In those cases, you can use a floss. Sorry, excuse me. Never mind. So
It's
you
fine.
can use the floss, and and you can use even a mouthwash. But mouthwash is always an added like adjuvant. It's not the preliminary or primary thing. Uh, you need to use it on a daily basis or a regular basis.
So it's actually the technique that we use while brushing, right?
Exactly the technique
Right.
while we brush that matters the most, more than anything.
And okay. And another question that I had was with the cleaning of the tongue. Does it constitute an important part of the whole oral hygiene?
I think your network. I couldn't hear you. Can you be little?
I said that. Can you hear me now?
Yeah, I can listen.
Yes. So I was saying that cleaning of the tongue. How, does it constitute an important part of the oral hygiene, just like cleaning
Yeah,
of the
100%.
brushing?
Generally people complain of bad breath. Okay, they'll tell like I have a bad breath even though I do my brushing in the morning and night. I don't eat much garlic, onion, and other colored stuff, or maybe like but generally they don't have any other systemic illness. Like few people will have a stomach ulcers, like peptic ulcers and other ulcers are quite common. But generally they don't have any other systemic illness, and they brush and maintain. They do not have a single calculus also, deposits also. But still they will have a bad breath.
Ma'am, your
They will
voice is a bit low. Can you please speak a
it's a
bit
bit low,
louder?
right? Yeah, once again, I'm
Yeah.
in my clinic. Actually, the compressor is running behind. That's why.
Oh, it's
Just give me a
okay.
minute. I think it will get stopped on its own. If not, I'll go and stop it. Like I
All
can
right,
also
all
like.
right.
You can hear me now? Is it okay, or do you want me
Yeah,
to?
it's
Is my
fine.
voice
It's
little
fine now.
bit? It's okay now, right? Yeah. So
Yeah.
what I was telling you is more. Yes, even though they brush twice, even though they maintain well, they don't have any systemic illness. You have to clean your tongue. Tongue carries a lot of microbes in your mouth. We generally don't know that, and the deposits over the tongue for a quite long period of time. If you're going to keep it same like that, the same what happens with your gums and the teeth. No, the same thing happens
Hmm.
with your tongue as well. It will create a bad breath. It will give you a bad odor. So must compulsory in the morning and night, or at least if you cannot able to like clean your tongue in the night, morning once at least it's compulsory. You have to. You need to clean your tongue to remove all your bad breath and the halitosis.
So it's the brushing and the cleaning of the tongue that actually constitute together.
True.
Important part
True.
of the oral
Yeah.
hygiene.
Yeah.
Another question that was that mostly the elder people, they are hardly able to do any brushing with the good techniques, right? So for them, it's more the oral hygiene really constitute just the flossing. So how do
Mm-hmm.
you say that is flossing that actually important? That brushing doesn't make a part of the oral hygiene.
You mean
Can
for the elder
flossing?
patients, right? When they were not able to
Yeah, yeah,
brush well,
and mostly for
generally.
the another, yeah.
Come again, I could mostly due to you were just telling
Most
something.
no, the elder people, for them it's flossing is the only thing that constitute the oral hygiene, and as well
Not
as the younger people too. They usually do just the flossing and not the brushing. So
true.
is the flossing really important, and or just the part a small part of the oral hygiene?
Okay. So the thing is, as I told earlier, if you were able to brush well, the deposits or
Hmm.
whatever between, flossing is mainly for interdental spaces. Generally, the food gets stuck in between, right? In between the two teeth, that is called interdental space. The food gets stuck, and then it's quite common. We don't remove it because your brush will not be able to reach that particular space. That when we use a floss. So floss is
Hmm.
not the like primary thing you need to use first. If you're able to brush well, if you're able to remove the deposit from your interdental spaces, you need not even use a floss. So floss is not the only thing, or floss is the main thing you need to do. No, it's not like that. It's never like that. If you were able to brush well in the morning and night, and you were able to remove the deposits from your interdental spaces as well, I would recommend you need not even use a floss. But for some
Hmm.
patients, like you will have a general gum weakness, or
Hmm.
the tooth will be separated. For few
Hmm.
cases, you will have a separation in between the tooth. You will have a space in between the tooth. In those cases, yes, flossing is needed because they will not be able to remove the deposit only with brushing. So it depends on each person. If you have a good teeth
Hmm.
alignment and if you are able to brush well, I wouldn't
Hmm.
recommend that flossing is the most important thing you need to do. No, it's not like that. But for some other patient, it could be different exactly. Like they will have a crooked teeth, and generally the food gets stuck in between, and they will not be able to reach because the brush won't reach that space in the
Right.
tooth
Hmm.
like that. So then in those cases, you need to use the floss. And there is coming to elder patients, since you were asking me, yes, they will not be able to brush well due to their age constraints and all that. So in that case, what we can do, there is something called electric brush. I recently given for my many of my patients, and they're having a very good results because you get a timer along with it, and the vibrations and the technique which we do in electric, it generally does it because it's a machine, right? It works on its own. So even they
Hmm.
just keep it in that rotates in a particular motion where all the deposits will be removed. Generally tooth has five surface, but we clean only the one. So when you
Hmm.
use electric, it reminds you that you have to do only for 2 to 3 minutes. It gives a perfect motion, and it
Hmm.
just cleans on its own. You just have to keep it. It does all the work. So for elder patients, if you were not able to brush well with the manual, definitely electric is going to help. You can switch to electric toothbrush, and then
Right.
maybe a floss if needed. But flossing is not the only thing needed. It's always a brushing. No, flossing is
So
secondary. No,
all
not much of use. For few it is, but not for everyone.
right. Okay. So here we talked about the brushing, we talked about cleaning of the tongue and flossing. For you, as a dentist, what is the perfect oral hygiene regimen for every person that they should follow?
Okay. So if you ask me, definitely it's brushing, but in a proper way. Maybe I could tell you also how to do the brushing because generally many people, whomever I have seen, they don't brush in a particular way. They just do. We just get up in the morning and then do however we want it. Rushing out of time. Probably we brush only for 1 minute, or it's like vice versa. we do for half an hour just watching TV or like looking in the mirror. The first thing you have to do is just have a 3 to 4 minutes for brushing, a maximum 3 to 5 minutes for brushing, not more than that. And the way how you brush, it should be always up down up down. Maybe have a model, I can teach you also if you want. Probably if suppose this is your brush, like you just hold it, it's never side because people generally do this, they give this motion. No, it's not like that. It should be always up down like a sweeping motion. You just clean from the gums. The concept
Right.
of brushing is always from the gums. Just open, clean from the gums, from the gums, from the gums, so the deposit is coming out from your gums. Generally in
Right.
between the gums and the teeth is where the food gets stuck, not on the surface of the teeth. Many will not know that, and they just give this motion. By doing this, you are just cutting your own enamel. You are just creating a damage to your teeth. So in those
Oh.
cases, brushing a regimen, what I do follow is a proper brushing technique, and for 2 to 3 minutes in the morning and night, it's always like this from the gums, from the gums. The same goes for the upper. If it's upper, it's like down. If it's like for the lower teeth, you have to bring it up, always up down. And only in the biting or the chewing surface you can do this. Others all it should be like up down. And you have a pie surface. As I said, it's not only the front, you have almost like five surface in your teeth. You have to brush all the region. It's not like you're going to leave the last tooth, or I'm going to leave my wisdom tooth, my brush is not able to reach. Even if your wisdom tooth, your brush is not able to reach, just close your mouth slightly and then put the brush in. It will definitely go and reach. If you open and then you're going to put in, it won't reach. Just slightly close and then you put the brush in, it will reach. So you can clean your wisdom tooth as well. It has to be cleaned. It's must. Because from wisdom, if you leave it, okay, it's only a one tooth, I'm not going to clean it. No, what happens? The microbes, whatever present, it carries through the saliva. The saliva is same, right, all over the mouth. So it gets
Yeah.
spread to one tooth, one teeth, and all most of the teeth will get affected because of one tooth. So the one tooth with this decay, are you not able to brush? It's must you have to brush it. So my
Right.
regimen which I follow is a proper brushing, and I
Yeah.
use a mouthwash, but it's not like on a regular basis. I probably use it like weekly, twice or thrice, but I dilute with water and then use it. Anything like non-alcohol mouthwash, probably you can use Listerine or Colgate blocks, anything without alcohol, because alcohol mouthwash will stain your teeth gently. So any mouthwash, if you use it, just dilute with water and then use it. So this I use like weekly, twice or thrice. And if you have anything, like if you could feel your gums a little bit weak, you can use a chlorhexidine. That's some medicated mouthwash. Even you can use it, but dilute with water. But once the
Yeah.
problem resolved, you may not use the same thing. You can just switch to a regular one. And there is one more device I started using recently, and it is giving me a very good results. Instead of floss, you've been talking a lot about the floss. I'll tell you the concept of floss is generally, as I said, the food gets stuck in between two teeth. You know that, right? So to
Yeah.
remove that, the brush was not able to remove. That's when we use a floss. So instead, the water pressure, there is something called water flosser, water jet flosser. It's available in online markets actually. In US or
Yeah.
any other abroad countries, if you see, they have quite common. It's quite common with them. So you just switch on the button. You just keep it with the water pressure. The deposits or whatever in between interdental spaces is
The
flushed.
oral irrigation. Right.
Exactly, oral irrigation.
The
I'll
oral
just show you
irrigation.
the device also. I have that with me right now. Probably I can. This is that device
Right.
actually. It is giving a very good result instead of regular thread floss, because sometimes people are not like regular with the floss. They're not happy. They
Right.
were not able to do the floss actually. So what they do, they just put in, and sometimes the gum gets bleed also.
Yeah.
So they're not regular. They won't be able to do. Especially the elder patients are quite uncomfortable with the general flossing, the thread floss. So in that case, maybe water flosser is an like a gift for them.
Right. So as you talked about US, I had a question that US has done really well in terms of bringing down the whole dentistry problems, right? So one of the measures that it took was that one of the community in US, they actually added this element called fluoride in their water supply. So what is this important element exactly?
Good, you have done a lot of research on it. I'm so glad that you know about fluoride, because many patient doesn't know that. Um, this is the most important topic, because fluoride is basically a mineral. That is what fluoride. And generally, your teeth needs a lot of fluoride, because many people think, okay, if you eat fluoride, or you're going to eat fluoride for a long time, if you get a lot of fluoride, you have this is called fluorosis. It's actually a condition of the tooth, like your where the enamel will get brownish tinted, and then the tooth will be like looking like a flock. But the problem is, You need fluoride. It's only for this patient who is having a lot of fluoride in water, the fluorosis is going to come. If your water has the minimal amount of fluoride, the 2 ppm or whatever the amount required for your enamel formation or the enamel growth, if you have the fluoride, nothing is going to affect. Nothing is going to affect your teeth. You need fluoride because many people are not understanding that. They're thinking, okay, fluoride is a mineral, it shouldn't be eaten and it causes quite other diseases and all that. Especially in India, they are thinking that if you use a fluoride toothpaste, as if like anyhow no one is going to eat the paste, but I'm just informing you. For children's, yes, they might eat paste. So I would recommend till at the age of 6 years, probably they need not use any fluoride toothpaste. But from the age of 6, that's when the permanent tooth comes out, right? From that age onwards, you need fluoride and it is mandatory. US and other abroad countries, as you said, they understood this concept very well. And what they did is they fluoridated all their waters. So instead of giving an as an added measure like a fluoride gel or a varnish, they have fluoridated the water. So when the patient is going to drink the same water, the content, the tooth, the enamel will
Yeah.
be more, and they will get a lot of fluoride in their teeth, and then they'll not get any pain further. Basically, you need fluoride to prevent toothpaste. If you're not gonna have fluoride, you will develop a lot of multiple cavities, multiple decays, multiple gum diseases will form. So anything with fluoride is must. I would recommend
Right.
toothpaste if you ask me.
Okay. Thank you for this answer. Basically, I would say this question that the UN, according to the UN definition, the oral hygiene determines our whole well-being. And most of times, when we say if a person is having diabetes, he would not be maintaining a good oral hygiene. What is this synonymicity? Like, what is actually oral hygiene determines our whole well-being? I wanted to ask.
Yeah, definitely, because you just eat through your mouth, right?
Yeah.
That's how. So the whatever you eat, basically, human live with food. We just
Yeah.
live for food. That's the true concept. But whatever you're gonna eat, it enters through this. But many people will not understand the importance of oral hygiene or oral important, how well you have to maintain your oral cavity. They doesn't know that. So and then they eat quite some. So diabetes. Coming to diabetes, I'll just tell you, like you have a sugar. Diabetes is basically a high sugar level in the glucose. That's how it is works. So what happens when the sugar level, the glucose level gets higher in your body? The same way you have sugar content around your gums in the blood glucose level and the gums will get increased. So the saliva has a lot of sugar in it. So what happens? Generally, you eat something, the food gets stuck, the microbe will get attached to it, it get attracted, and then it ferments, get converted into a decay. But when with diabetes patient, what happens is the sugar level is more. Basically, the microbe get ferments
Yeah.
with sugar. It eat
Yeah.
like it feeds with sugar. So the content, whenever it is high, wherever it is high, the microbe will go into it easily. It ferments fast, right? And then the spread of the
Yeah.
microbe is quite easy and it vast. It goes everywhere. Like almost like one tooth gets affects and multiple tooth gets affects. Because diabetes is something like a multi disorder. It's like systemic. It doesn't affect
Yeah.
one particular tooth, unlike like decay, other thing. So with diabetes, patients has to be really careful. Once you get diabetes, like how you maintain it, right? It's lifetime maintenance. You have to have the sugar level in your control. Same like that,
Yeah.
you have to keep on checking your gum. Periodontitis, we call it. It is called a gum condition where your gums get swollen and then tender and then it gets bleed. Generally, even with the regular brushing, it bleeds. That is called periodontitis. So make sure once you have diabetes, you will have periodontitis for sure, even though you maintain well, even though you do all stuff. But what we can do, we can control this. Same like how you control your sugar level, you can control your periodontitis by a good regular brushing, just meeting your dentist every 6 months once. In fact, I told you like in the beginning, every yearly once or 6 months once, we need to clean our teeth, right? In fact, for diabetes patients, it's quite common. Like even 3 months once, you can clean your teeth because the deposit is more for them and the sugar level is more for them, not like a normal
Right.
people. So they have to clean 3 months once or 6 months once. Depends on their sugar levels and the condition. Yeah, it
Right.
has a direct
So,
relation. Both. If you're not going to control your sugar, periodontitis will get worse. The gum condition will definitely gonna get worse. And same way, if you're not going to treat your gum disease, if you get the gum infection first and you're not treating it, it will get converted into a diabetes also. It's always directly
diabetes.
proportional. Both are direct. Yeah, both are directly
Yeah.
proportional.
So, like for like diabetes, we have this various preconditions which actually tell us to go to a doctor. So, what are the
Yeah.
preconditions that actually tell us to go to a dentist? What are those?
The main first symptom is the bleeding, and you will have a mild sensitivity. Once you get bleeding, that's the initial symptom. Even if you just keep the blood, people gently come here and tell me like, "Ma'am, I get bleeding on and off. It's not quite often I get bleeding, but sometimes if I touch, it bleeds, and sometimes it doesn't." So it's a symptom first. It is showing that the microbe already settled into your gums, and the gum has started getting weak. So that's in the grade one. You just meet your doctor immediately, and the other symptom is sensitivity. You might get mild to moderate sensitivity where the enamel will be weak. So that is the another symptoms. And for few patients, you could see the mobility also. There won't be any plaque or there won't be any calculus, but they could feel sometimes if they touch the tooth, no, they could feel the tooth is moving, the mobility. These are the main symptoms for periodontitis. If someone could sense all this, they should meet their doctor. It's necessity that they have to do. If not, if left untreated, they might have to lose the teeth as well. The tooth, we have to pull out the tooth. The tooth will fall over a period of time.
Right. So, ma'am, here's one of my last questions to you: is that in the field of dentistry, there has been an increasing number of women, right?
Right?
So,
True.
like, how do you see this increase of number of women as an impact in this whole field of medicine? How is it going to turn out to be?
Actually, I'm so happy and glad to see that a lot of young dentists, young women
Yeah.
dentists coming forward, and then they wanted to be a dentist. Because before dentistry was something like only one or two. Even if you go to some college and ask them, if you ask some students, the school children, you ask them what you want to be, they'll tell I want to be a doctor, but no one will tell
Yeah.
I want to be a dentist,
The
right?
dentist.
So yeah, exactly. They don't want to be a dentist, but only a very few, very rare. But right now, even if you just talk to normal people like school or children, like your own community, if you just talk to them, they wanted to be a dentist. So they have that awareness that dentist is also a profession, and it's like it's very good to maintain. As you said, oral hygiene is first, and through mouth you eat everything, right? So first you
Yeah.
have to take care of your oral cavity, and everything will sort out if you're going to take care of your oral cavity. The person who is going to treat the oral cavity is a dentist. So I think it's one of the most I could tell honorable also, honorable profession. I will tell personally if you ask me. I wanted to be a dentist from the beginning. So many dentists are nowadays coming forward, and students are coming forward and asking us how to be a dentist and what all we should be doing to become a good successful dentist. For them, I would tell have a strong passion, because dentistry is something you need passion.
Yeah.
Unless and until you don't have a
Yeah.
passion, you can't do it. You need to be really connected with the tooth and connected with the patient. You need a good communication skill, and you need a good hand skill, because it's art. Dentistry is not only
Yeah.
like what you are studying
Yeah.
and whatever you do, because we have done quite a lot of handworks before getting into this. Those 5 years, we have to carve the tooth. With the wax pattern, we have to do it in the beginning. We have to do plaster. We have to do molds. There are a lot of stuff involved. More than MBBS, I would
Yeah.
tell dentistry is difficult. So that's why people maybe they don't choose dentistry. I guess so, because it's quite difficult. The
Maybe.
studies and whatever the exams, it's art, a combination of art and science. That is dentistry basically. So if you have a strong passion for art, you should choose dentistry and keep reading, keep learning. The thing is like too much. It's not like okay, this is done. I've finished my studies. 5 years is over. It's
Yeah.
done. I'm a dentist. No, you have to keep reading daily, daily, daily on a daily basis. There are improvements in the world. There are improvements in the field of dentistry. Especially the cosmetic dentistry is booming right now. So if
Yeah.
some want to be a dentist, you have to keep reading, have a strong passion towards it, and have a patience too, because each patient will be totally different. So you have to be dealing with everyone in a different way. So for that, you need a lot of patience as well. All this thing.
Okay, thank you so much, ma'am. Now we have certain questions from the public as well. The first question is from Nisha Haryani. She asked you that how can children maintain a good oral health?
Very good question. There are people ask me, generally people used to ask me, at what age a children should generally meet a dentist. So I will tell you, right from birth. We think only when the tooth erupts you're gonna meet your dentist. No, it's not like that. The baby, once it's born, you feed it, right? Especially breastfeeding mothers, they don't clean the teeth and they feed it in the night, and then they don't, because they generally they don't have a teeth, but they have a gum pads. So that only the
Yeah.
tooth is gonna erupt. So if the child, the mother, they're going to keep on bottle feed the children in the night and they're not going to give water, or they're not going to wipe it with a wet cotton cloth or something, you obviously will get a lot of microbes stuck to the gum pad. So when the tooth comes out, it will get decayed and you will get a lot of rampant caries. The caries will be spreading very fast compared to the other tooth. So what I would tell for the children, right from birth, please meet your dentist. If you could see sense some sort of small discoloration, a small brownish tint in the tooth, just meet your dentist. Every 6 months once, have a regular checkup. You need not do any treatment, but just have a word with them whether this is quite normal to have from a children. That you have to do that. Uh, I mean, generally in Indians, people think that only if you get a pain, you should meet a dentist. No, it's not like that. Always have a regular checkup because once the pain comes, the treatment is going to be more on you. So if you could meet the dentist, it's in the initial stage, you can correct it earlier and the treatment is also going to be very less and minimal. For the children, as I said, just wipe the gum pads. If you're going to feed or breastfeeding in the night or bottle feed, just give them a sip of water after each meal or whatever. And 2 times they have to brush. And parents has to brush their teeth till the age of 10 years because whatever they do brushing and they'll tell they will brush, but no, they're not brushing their teeth proper. You have to have a constant check. And any one of the parents in the morning or in the night, they have to brush the teeth till at the age of 10. If they were able to do that and meet the dentist 6 months once, easily the teeth can be maintained.
Right.
And
So
avoid
the
maybe
second,
like lot of cakes, lot of chocolates. It's not like I'm telling you that you have to have a control that you should never give them a chocolate or cake. It's not
yeah,
like that. Please do give. They will carve for sweets. But what you do once after they eat sweets or chocolates which stick to the teeth, just give them a sip of water, probably hard water, or you can just give
yeah,
them a brush. The brush and immediately. You have to do that. You have to follow that.
right. So the another question is from Anushka Goyal. She asked that what are the early signs of teeth trouble?
Mm. As I said, it varies from patient to patient. But mostly in general, the common scenario with everyone is bleeding gums. People generally notice the bleeding. The gum is getting bleed when they brush. That's a major complaint. So that's a symptom which is showing that the gum is going to get weak and it's already weak. The microbe is already into your mouth. And the second symptom I would tell it's sensitivity always. They'll feel, doctor, if I take something very cold or if I'm taking something hot, I feel the sensitivity in my molars. That's because, okay, your enamel, it's already gone in that particular place. There's something wrong with the tooth. You have to meet a dentist. So these two are the major symptoms. And for some patients, it's like the tooth, they might get a trauma and the crack could be there. Or there'll be a tilting or the drifting of the tooth. Or there might be mobility and the discoloration. All these are the symptoms. But major, it's bleeding gums and sensitivity.
Bleeding and sensation. So the third question is from Seema. She asked that does teeth whitening toothpaste improve the color of her teeth?
Yeah, Seema. No, teeth whitening toothpaste. It's like I could see nowadays in the internet there are a lot of DIY hacks going on for the whitening of the teeth. They're using turmeric powder, they're using coconut oil, they're using so many stuff. And someone was using a bleaching powder also, yeah, to make their teeth white. No, please, never do that all. It will never work, to be frank. As I first beginning, in the beginning, I was telling you, remember, tooth is never white. It is
It is
not
never
white.
white.
It's not white like what you see in the advertisement. Yes, generally it is white, fairly white, but not like Colgate, any other toothpaste ad or any other white. It's not like that. So any toothpaste, whatever whitening toothpaste, whatever we use generally, it doesn't give much of effect. Even I told you, you need not even use a toothpaste if you know the correct way to brush. There is a technique to brush. You're gonna follow the technique. You need not even use a toothpaste. I would tell that. But fluoride is needed. So in that case, for a fluoride, you might go for a fluoridated toothpaste, not a whitening toothpaste.
Right. So there's another question from Meena. She asked, "What are the best ways to practice good oral hygiene at home?"
Um, Good question, actually. I will tell you, like, main thing, as I said, toothpaste is okay, mouthwash is okay. Whatever you're going to use doesn't matter. But only thing is, whenever you get up in the morning, make sure you brush your teeth. Even with it, you will not even use a toothpaste here. You just need a brush. But the way how you brush matters. As I said, if you're going to remove all your dirt from your mouth, it's like up, down, inside, outside, everywhere. You're going to brush on all tooth surface, on pie surface of your teeth. You will never get a problem. That's the first and foremost. And after each meal, if you're a person, um, you feel your tooth is a little bit crooked and it's like tilted or something, your brush will not be able to reach in that particular portion. So in those cases, you can just gargle. After each meal, you have to keep on doing the gargling. And in the night, especially after your meal, you have to brush it. Because I have seen few patients, they used to brush and then they go and eat and then they sleep. No, it's not like that. It's always like you have to eat the meal and after that you have to brush your teeth. After brushing, no eating, nothing. That they have to follow. So morning and night, 2 times with a proper way of brushing and a fluoride toothpaste will do.
Right. So, I then I don't. Okay, there's another question. The Anjali asked that children always carve for sweets and chocolates. So, how to maintain a proper health care for children as they are not aware of severe consequences of that, and what proper hygiene need to be set for them?
Okay. To maintain proper children sweet. Okay. Children at the age of probably what you're telling is true. From 3 to 4 or 5 years onwards, they carve for sweets and chocolates, generally children. But I've seen many patients and many parents by telling me that once they just come to me and then I'll just give them a few advices and I tell them like you shouldn't be doing this, you should, because parents generally tell the children they will not, because they'll be telling so many things, so children will not obey them and they'll not be like no I will eat, I want that, because they've pampered like that. So when I would recommend you go and meet your doctor once, a dentist once. If a doctor or dentist is going to tell them in a proper way that what is the consequences, so what is going to happen if you are going to eat chocolates or you're going to eat biscuits on a long run, which stick to your teeth, they will understand. They are understanding. I could see many children who come here. No, I just tell them, I just counsel them. They stop eating, and in fact, even if they eat, they will ask the parent, "I need to brush my teeth. Where should I give me the paste and brush
Yeah.
immediately once after this?" So it's basically the information and how well you teach your children, how well you educate them. So that is the main and first foremost thing. Further sweets carving, if you ask me. The second thing is a brushing. That definitely it is a child until at the age of 10, whatever way we tell them, like certain to the certain amount they can follow, but they won't be able to brush like an adult. So that's a true fact. So parents have to be with them, they have to accompany with them with brushing. In fact, they can brush their teeth till at the age of 10 years. I would strongly recommend that. If they're going to brush, no problem will happen. At least once in the morning or night, whenever they get time, they have to brush their teeth. And as I said, the maintenance wise, it's a proper brushing. And anything night, don't eat after your brushing. After your meal, you have to brush your tooth. Night brushing is most important than the morning brushing. And use a good toothpaste, fluoride toothpaste, because children need more of fluoride. They are going to get their permanent teeth. The permanent teeth
Yeah.
needs a lot of fluoride in it, so please give them a fluoridated toothpaste. Anything, it's okay. Any plant is fine.
There's this Ria Singh Verma. She has two questions. First, can a bad teeth cause stomach problems? And the second one, difference between a root canal and a cavity.
Can bad teeth cause a stomach problem? Yes, there are, but it's not like that's the only thing. Because of my bad teeth or because of my cavity, only I'm getting stomach pain. No, it's not like that. It's never like that. Generally, the food gets stuck and then the decay gets formed. It's full of microbes. So you're gonna eat the microbe, like you're eating along with the tooth, right? Whatever you eat, it gets stuck over there. So there are chances you might get infections in many cases, and moreover, if the tooth is decayed or if it's bad, you won't be able to bite and chew proper. You won't be able to munch proper. You can't swallow the food. You have to munch and then eat it. Then only the digestion will be proper. If you're not going to eat, I mean, you just swallow it, gulp it, you will have a lot of stomach problems due to indigestion. You will have a lot of peptic ulcers forming in the stomach. All this happens. Yes, that is a correlation between a bad teeth and your stomach. And coming to, he asked me another question: what is root canal and a cavity?
And cavity.
Generally, cavity is something called it's a decay. Okay, cavity is like a tooth decay, the blackish discoloration which starts and then which gets deeper into a hole and then it touches your root. Okay, there'll be three layers in your teeth generally: enamel, dentin, and pulp. The pulp layer is called the third layer. The third layer is called the root. So once the cavity starts and then it's spread inside, and then it goes into your root, the pulp chamber. Once it reaches the pulp, you will have a pain or a sensitivity. That's when it already touched your nerve. For that, the treatment is root canal. You have to clean your root. There is no other go because already the root is affected. You have to clean the root. That is called root canal. Once the root is cleaned, you need not do anything else. Like the tooth is strong, you need not remove the tooth. Just put a cap on top of it so that the tooth can be saved. Basically, root canal is saving your teeth. from removal, from extraction. In olden days, we didn't have all these options of root canal, but now people have to do root canal. That's the best option because if you pull out one teeth, no, you are affecting three teeth because of one teeth. You know that the next two teeth will get shifted into that place wherever you have removed, and the upper teeth wherever you have removed will slowly drift into that particular place. So because of one tooth, the three teeth generally gets affected, and moreover, you are not able to chew in a proper way if you're going to remove the tooth, right? You need a tooth to munch and eat. So generally, you will swallow or eat on the other side. So what happens? If you've been keep on chewing only on one side, that tooth also will get affected. That segment of the tooth, that segment of the jaw also will get affected. So always never remove the tooth. Do a root canal. Root canal is a good option to save your tooth. You have to.
So this is another question by Nisha Haryani, who is that what type of brush and toothpaste should I use?
Okay. As I said, like toothbrush, I would recommend any brand is fine. But while using, please use a medium or a soft toothbrush. For Indians, it's always medium or soft. We can use a medium toothbrush as well. If it's a younger patient, till the age of 30 or 40 or 50 as well, you can use a soft toothbrush. But more than 50, because the enamels generally will be weak and your gums will be weak, you can move to a soft toothbrush. The bristles should be soft. And coming to the toothpaste doesn't matter that you need to use only a white toothpaste or you need to use only no brands it's needed actually. Anything white has a lot of fluoride, so I would recommend any toothpaste which is white in color. Use it. Need not go for organic. Like many people in recent times I've been noticing they've been using Dauber Red or any other like colored toothpaste. They think it's organic and they have to use it. Yes, organic is fine, but you need little amount of fluoride also in your mouth because generally we don't have in water. Our country doesn't have much fluoride in water, so you need fluoride. That's the toothpaste is the only source you're gonna get the fluoride, right? So you can use a toothpaste which is white in color and which has fluoride in it, not those whitening and all that. It's not needed yet. It is not much use. No use because of the whitening toothpaste.
Right. So there's another question by Seema that most of us have heard that rubbing a fruit like a banana peel or lemon can make your teeth shiny. All the fruits are considered beneficial. How can it be appropriate to rub them on teeth? Does it their acid damage the tooth enamel?
Yeah. Correct. What they are telling is like I've been telling you, there are recently DIY hacks is going on. You can whiten the teeth with a banana, with lemon, and with turmeric and with coconut oil. This is all bullshit. Definitely, I tell you, no, it doesn't work. It's just a hack, or maybe an advertisement. What they are doing. If you're gonna rub more of lemon, because lemon is acidic, right? Anything acidic, you're gonna put on your tooth and then you will keep on rubbing. Generally, what happens? More of acidity, more of acidic Coke or any other drink, it has a lot of acidity. That's why people tell you, a dentist tell you to avoid always a Coke or any acidic drink, soda or anything, because what happens is it just stuck on the tooth and then it changes the pH level of your tooth. Enamel will get generally the pH of the enamel will get varies, and then the enamel will get go weaker between consuming a lot of acidic thing. The same way lemon also the acidic, right? Or any other stuff, whatever they're gonna apply, and then they're going to rub it. So what happens if you keep on going to rub? If you go keep on rubbing or traumatizing the enamel will wear off. Once the enamel wear and tear happens and then the enamel goes, you will end up in sensitivity. You will end up in LO teeth. You will end up in a root canal final stage. So please do avoid all those things. It is of no use. No way it is going to help you in any way. In fact, you people who drink a lot of, because generally for weight loss they are drinking a lot of lemon and citric in the morning. I've been noticing with many people. What they can do instead, drink, but immediately you have to drink the water as well. Maybe a cold water or water, you just drink it and rinse it immediately. Then you brush it. Then you consume whatever you want, because the acidity will be there still in your mouth, and it will lower your tooth very fast.
Right. Is there another question? There's another question by माया महेश्वरी. 42 साल की हूँ. मेरे सारे दांतों का रंग फीका पड़ गया है. दाढ़ों में और कैविटी होने लगी है. इसमें फिलिंग करवाई है. कुछ तो हटाने भी पड़ा. डंडा खाने के दांतों में झंझनाहट होती है. और क्या इसका कारण र्यूमेटिक राइट्स है भी हो सकता है. मैं पिछले 6-7 सालों से इसी में पीड़ित हूँ और अराया फिकेट 87 से 114 के बीच घटता बढ़ता रहता है, इलाज जारी है, परेशानी केवल सदियों से ही होती है।
Could you explain me the question, because I'm very weak in Hindi? I'm so sorry for that. I'm a South Indian.
Okay, the question has disappeared from screen. Okay, there's another question. The question is that are sweets, candies, and ice really bad for teeth?
Yes, definitely, because sweet has a lot of sugar, and the sugar generally attracts a lot of microbes. And candy, the same thing. The candy go and get stuck into the tooth, and then where the microbes get into your tooth, and then it gets stuck into the tooth. And ice is also the same thing. Sometimes what happens, ice people generally tend to bite the ice. No, the ice is a stronger thing. So when they bite, they will keep on doing that over a long period of time. The tooth will get chipped off, the enamel will get worn out in that particular place. So all this will lead to decay, and eventually the tooth might fracture over a long period of time. So it's not that you should never take ice, you should never take sweet or candy, but you can take, limit the quantity. You can, like,
Right.
you take, but weekly, like probably twice or weekly once. That's enough, not like too much. Maybe
Right.
weekly thrice is also fine, not a problem.
There's another question by Nisha Haryani. She says that how to prevent tooth decay, gingivitis, and other problems.
TK gingivitis is the problem. Good question. Yes, the major thing for tooth decay is your improper brushing. If you're going to brush your teeth well, and if you remove all your deposits, you will never get a tooth decay. Gingivitis is a condition where your gums get inflamed generally. That is also another symptom. Like if you have any systemic problem, like diabetes or anything else, any systemic condition like myocardial infarct, like something, could be some heart problem or anything, your gums will generally get weak. But if you go and meet your dentist and get this regular scaling done every 6 months once, you will not get those problems quite often. You will not be having any gingivitis. And tooth decay and gingivitis is a major problem. If you are able to clear this both, you will never get a major tooth problem. This is the initial. The starting is basically gingivitis and your tooth decay. If you're going to meet your dentist and then get cleaned immediately, that will not spread further. So you will not end up in a major tooth loss or root canal. Yeah, it's quite simple as that.
Right. And there's another question by Ram Savarup. As Invisalign is very expensive, is there any alternate treatment?
Yeah, actually, Invisalign is booming. As I said, cosmetic dentistry is booming, right? Invisalign is an alternative for braces. Basically, Invisalign is like an alternative for braces. You would have heard of braces. Generally, people wear the metal
Yeah.
braces, which will be seen out, and
Yeah.
they have to go through a lot of, like, 1 year the treatment will be proceeded, and then you have to meet your dentist monthly once to correct it. Even if the one braces get removed or one brackets get removed, you have to meet your dentist quite often, and it might poke your gum sometimes. You have to
Yeah.
give up all your favorite food. You are not able to all your favorite food because of the braces generally.
Yeah.
So all these things can be controlled with Invisalign. Invisalign is something like a tray, a transparent braces, like in which you need not meet a doctor or a dentist while eating. Anyhow, you have to remove, and then only you're going to eat. So there will be major issue of food restriction. And while cleaning, it's quite simple, because anyhow you're going to remove the tray, and then only you're going to brush your teeth. So same way, maintenance wise, it is not affecting you, and same way, eating wise, it's not affecting you. It's quite comfortable because you will not have any poking, anything in that. It's just a plastic kind of silicone, so it gets stuck to the teeth. Every weekly once or weekly twice, you have to change the tray. So once you change the tray, at the end of the year, you're gonna get the results. You need not meet your dentist. So that is called Invisalign. And yes, Invisalign is costly, because it's not from our country. Invisalign is from
Yeah.
US, actually, United States, and you have to export. There are a lot of things, and that's the only company which deal with the whole world, the nation, the whole world. They treat. So there is no specific lab as such for only for India or something like that. So that's the major reason why it is costly, because they charge in dollars. So when it comes to India, the price is totally high. There are many alternatives, as you asked. Invisalign is not the only thing available right now in the market for moving your teeth. The alternative is braces. Braces from olden days, you can go for braces. It's a bit cheaper, but you have to get few discomfort because of the braces. That is one
Yeah.
thing. And there are other brands available other than Invisalign. I would tell there are a lot of good brands available in the market right now, like Flash, which is from Mumbai, and there are 2 3 other companies. available. They're also doing pretty good thing. They're giving a good results. So if people who can't afford Invisalign, they can definitely choose the other options of other aligners. It is possible. It is available actually.
Right. We are done with the questions here. I want to ask which question was your favorite one, so we can give away the prize for that.
Mm, okay. I would personally. That's because there have been a lot of questions.
That's
I think her name was Nisha or someone Neha.
Nisha Haryani. Yeah, Nisha
Yeah, Nisha.
Haryani.
I think because you've been asking multiple questions like for children, what is the regime to be followed, and what toothpaste and toothing has to be followed, and what is the proper oral hygiene. She was asking me. So I think since she has a lot of awareness on the tooth, I would think that question I would
So we
give it.
have Nisha. Okay. So we have Nisha Haryani as the winner of the first round, first giveaway, and she again has a question. What's the best way
Now.
to whiten teeth? She's actually on a roll right now.
That's what I said. We'll keep on seeing her question here. So I think I
Another
should give it to
question
her.
is here.
But to get to them to check up. Good. Nisha, actually, as I said, from birth, from birth, you have to have a check for your oral cavity. You have to keep your oral cavity neat and clean. If you're not going to keep it neat and clean, you will end up in a tooth decay. You will end up in a sensitivity, or you will end up in a bleeding gum. If you're still not going to meet your dentist, then it gets worse, 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 and then on final stage, you have to go for a root canal or you have to remove your tooth. So there is no specific timing that you should meet your dentist. Meet your dentist quite often, 6 months once, and have a regular checkup. Just a checkup. You need not do any fancy treatments, but just go meet your dentist, have a checkup with them. Just ask them: Is my tooth is fine? Is it okay? Is it good? That awareness is lacking in India. They need that.
We can take a last question as Maya Maheshwari has one. That she's a 42-year-old. All her teeth has been discolored due to cavity in the molars. Filling has been done in them, and some of them have been removed. The cold food causes tingling in the teeth. Could it be caused by rheumatic arthritis? And she's suffering from last 6-7 years and have a RA factor which keeps on fluctuating between 87 to 114. The treatment continues, but the trouble occurs only in winter. So, please enlighten her with this question.
The molar spilling has been done, and the stem. Some also has to be removed. Hmm. Cold food. Okay. Maya, actually, I didn't check your condition yet because with whatever the symptoms you're telling me or the information you're giving me, like the past, whatever you have done. So I can't give you a treatment plan. This is the accurate treatment plan I won't be able to give you. I just have to check your teeth once so that I can give you a proper treatment plan. What is the condition of yours and whether your history is correct and what they have done. Because you have been telling like one tooth they have done a filling and it got removed. So if you keep the removed filling as such in that particular place, it will definitely touch your root, right? So you will have a sensitivity, you will have a pain. So I would recommend you just meet your dentist, and wherever the filling is broken or fractured, please get it removed and just clean it and put a new filling, new cement into it before the progress into a pain. Because once the pain comes, we will not be able to do a filling. We have to do a root canal. So you can avoid that by meeting your dentist. And there are a few other things like RH factor deficiency also you've been telling. So just have a word with the doctor before doing any procedure, like how is your plasma level right now, and then I would recommend you to start up with the treatment. Uh, for root canal and filling, it is not like you need not do anything much. You can carry away, you can proceed with the procedures. But if you're gonna leave it and still you're not treating it, the root canal or any other treatment you're not gonna do, eventually you have to remove your tooth. That's where the bleeding will be more and it will affect your systemic health in any way. So take it to consideration. Just meet your dentist at the earliest before the pain comes.
So the question ends here, and we have an announcement. Um, we have an announcement that Anjali is the winner of the best question. That particularly the doctor she asked to the doctor, and she can avail her prize in the given number, which is 9818 366 and 242. She can note it again, and I'm gonna repeat it again: 9818 366 242. So this session has been really productive as we can actually we started from the general idea that the that teeth with plaques can also be the healthy ones, right? And it doesn't have always have to be straight and white. It can be crooked. There's also the cleaning of the tongue. That's actually really important. Like it can create a bad odor, which actually constitute the whole oral hygiene. The flossing is also important, but to a specific age for the people. Like in the recent times, there has been new innovations like oral irrigation, which has helped people to reach into the places where the toothbrush can't. And then there's like a perfect oral regimen which can be constituted of brushing and like twice a day and actually maintaining a right balance of fluoride through a right toothpaste, which is specifically the white ones, right? And obviously it's all reaching out to a dentist is always a perfect time, or always has a perfect time, and it's perfectly before having a bleeding or something, and always having a regular checkup every 6 months. And obviously our mental oral hygiene constitute our whole well-being. So it's really important because whatever food we eat goes from our mouth, and it has to be maintained in a certain way that doesn't affect our whole body, right? So thank you so much, and we have this. We will be announcing for the lucky draw, which will be done by Mr. India. Um, right. We have Neelam Vijay Patwal as the winner for the lucky draw. Neeraj Patyal can actually avail his prizes in the number 9818 366 242. So thank you so much, ma'am. It was really a pleasure to have you here.
Thank you, Preet. You hosted it really well. Thank you so much. Thank you, Pinkish Foundation, for giving me this opportunity. It's an honor. Thank you.